Hello, I'm Mike Ryan, and welcome to BNAP Today, Monday, August 10, 2020. Taiwan has successfully managed coronavirus with a very comprehensive set of policies. Our special guest today is Professor Chang Chuan Chan. The US National Security Advisor Robert O'Brien has suggested Chinese-linked actors may have targeted US election infrastructure ahead of the November presidential contest. But first, the headlines. After US counterintelligence said Russia was actively working to undermine Democratic candidate Joe Biden ahead of the presidential election, President Donald Trump's National Security Advisor said China was trying to actively interfere as well. This report from Zachary Goelman.
The U.S. National Security Advisor Robert O'Brien on Sunday suggested Chinese-linked actors may have targeted U.S. election infrastructure ahead of the November presidential contest.
China, like Russia, like Iran, have engaged in cyber attacks and phishing and that sort of thing with respect to our election infrastructure, with respect to websites and that sort of thing. We're aware of it, and we're taking steps to counter it, whether it's China or Russia or Iran. We're not going to put up with it.
He said hackers had targeted U.S. government websites, but did not specify what damage the cyber attacks had done, if any. O'Brien suggested the U.S. election faced an array of malicious actors, including Russia, China, and Iran. His comments on CBS News Face the Nation come in the wake of a U.S. counterintelligence assessment that China preferred President Donald Trump lose his bid for re-election.
The Chinese don't want the president re-elected. He's been tougher on China than any president in history.
That assessment from Director William Evanina of the National Counterintelligence and Security Center last week said that while Beijing preferred Trump lose, Russia was actively using a range of measures to, quote, denigrate the Democratic candidate, Joe Biden. U.S. intelligence concluded that Russia interfered in 2016 to swing the election toward Trump by stealing and leaking emails damaging to Democrat Hillary Clinton and by spreading misinformation on social media. Russia denies interfering in American politics. Trump has long downplayed and denied Russian efforts to help him win, and contradicted even the most recent assessment from his own administration.
I think that the last person Russia wants to see in office is Donald Trump, because nobody's been tougher on Russia than I have ever. Well, I don't care what anybody says.
Evanina said this time it appeared pro-Russian actors were trying to push unsubstantiated claims that Biden was tied to corruption in Ukraine. Asked what the U.S. was doing to counter the latest Russian meddling, O'Brien said no administration had been tougher on Moscow.
There's almost nothing we can sanction left of the Russians. We've put so many sanctions on the Russians.
But appeared to suggest there was little more the U.S. could do.
Coming up next, Taiwan and coronavirus.
There is a place in the heart of the Pacific where people greet each other with life, happiness, and good health. Where Mula is more than just hello, but a feeling buried in the soul of every Fijian. To care for our family and neighbors, find humor where there is little, and hope in uncertain times. Mula is in our DNA. We love to share it with you, and it is yours to share too. For now, we must be apart. But when you're ready, we'll be here, just like always, waiting to share our home with you again.
We are Lions. We bring hope where it's needed. We are a global force for good. Join the movement. Support causes that matter. Change lives. Change communities. Change the world. we can do more together than we can alone. Join in. Experience the joy of serving. Be part of the movement. Give back. Let's unite the world for good. We are lions. You can be too. Visit weserve.org.
Fabric masks should ideally have 3 layers: an outer layer, an inner layer, and a middle layer, which can be an insert or can be another fabric layer. The inner layer, which comes in direct contact with your face, should be a hydrophilic material, meaning it will easily absorb droplets from your exhaled breath. An example of this material is a cotton. It is important to select a light color such as white, which can help determine when it is soiled or wet. A good place to find this is in a woven or knit cotton t-shirt. The middle layer should go into a pocket between the inner and the outer layer like this and should act as a filter. This should ideally be a strip of polypropylene fabric, which is a spun-bound, non-woven fabric material. The outermost layer should be a hydrophobic material. This means that the fabric will repel droplets and moisture. This can be made of a synthetic material such as a polyester or a polyester and cotton blend.
Professor Chang Chuan Chan is a leading figure in public health in Taiwan and a frequent contributor to media on Taiwan's management of the coronavirus. Professor Chang Chuan Chan is presently Dean of National Taiwan University's College of Public Health, and his prior appointments include Associate Dean of the College and Director of the International Health Centre at the College of Public Health. Professor Chan has held numerous expert advisory and consulting roles. He holds a doctorate and Master of Science from the Harvard School of Public Health. Professor, thank you for joining us.
Yeah, it's my pleasure to be with you.
Taiwan has successfully managed coronavirus with a very comprehensive set of policies. What are the greatest risks right now to keeping the virus under control?
You know, the greatest risk is the same as the rest of countries. We have to be aware of these symptomatic or pre-symptomatic patients. That means our passive surveillance system, when we see people with symptoms, then we try to test them and quarantine them. Seems to be not enough. There's a lot of patients, infected patients, especially young people in the community, that we have to find a way to find them earlier and if necessary quarantine them. Then we can stop the spreading of these kind of cases to the communities. I think that's we are facing now.
Do you think the goal of elimination is just unrealistic?
Oh, yeah, I agree with the majority of the experts in the world. We have to live with this virus for a long time, and it's not realistic that we can find a way to eradicate. It's so prevalent now in every corner of the world, and you have no way to find every cases. So it's better we have to find a way to deal with this virus.
Everybody was hoping and talking about and talking up a vaccine, but as time goes on, that hope sort of seems to have faded. What are your thoughts? Do you think we'll get a vaccine?
Yeah, it's become more and more promising now. I think we will have one of the first result of vaccines, like by the end of probably October, and there could be some of the vaccines which with some efficacies and coming up. And I think this is a good news. And as you know, a lot of companies and countries are already start producing all these vaccines from now on. So by the end of the year, there's will be vaccinations going on in some countries, targeting the most vulnerable and high-risk groups. So that's unprecedented in history. We can develop a vaccine so fast. And I think this is good news.
We've read that Taiwan was not required to impose shutdowns on the economy. Were there any local restrictions to economic activity?
Yes, we from the beginning we decided to do soft social distancing. That means we don't order stay home quarantine for the entire community, and we don't have very strict restrictions of business operations. And the most dramatic measures we have ever taken is to delay the opening of the schools. So to avoid mass gathering in the campus from primary school to colleges, I think worked. And the other one is this cultural activities, some religious activities that usually attract thousands of people in a very short time. So we are not banning that. We went in a process of persuasion and cohesion, and finally got the cooperation of the religious leaders to avoid this kind of mass gathering. And we have this universal mask wearing. First is voluntary, and later we have mandatory requirement for all public transportations and indoors activities. So these kind of things avoid us to totally shut down the business operations. And we encourage the business owner to cut down the customs by impose this social distancing, which is like 1.5 meters social distancing in all settings, including bars, restaurants, and etc. So that's it turned out to be a very good way. That people have still have rooms to socialize a little bit, but the premise is that mask wearing is the must, and the compliance at that time for mask wearing is almost 100%. So I think that's what distinguished Taiwan's experience from other countries.
Interesting, in Australia and other parts of the world, there's still the not mandatory wearing of masks. Victoria and Australia, of course, they have to now wear the mask because of the outbreaks and the complete shutdown of the economy in Victoria, just about anyway. What do you think of those two questions here. What do you think of those that don't wear the mask? Do you think it should be mandatory? And the other question is, do you agree with the rolling, open, shut sort of thing as the main way of reducing the infection rate?
Wearing mask has two outcomes. One is to protect others. Then if as many people can wear masks, then it turns out we can protect ourselves because everybody is doing this. So on the other hand, it's only a small proportion of people are doing this. Then those people who are wearing masks could protect others, but the rest of us who are not wearing will has a high risk of transmitting this virus among those who are not wearing. So it's kind of herd immunity. I always advocated. That's before we have real vaccines, using mask as kind of quasi vaccines that you have to wear that when you are required to do that in crowded environment, especially indoors, in the transit, and even outdoors, and wear it as much as you can. And when you like to wear it, you have to wear it. So this is kind of things I think if I can have advice to Australia, you have to mandate this, but you have to do more mass communication to the population, the need and the science of wearing this. And we Taiwanese learn from the SARS, studying that time, every household always has some masks in stock, and majority of people who are traveling in buses, in subways, has already wearing masks from the during non-pandemic time already. So I think that's become a culture, and it's very good to fend off the newly emergent diseases. And I hope these kind of things that can be adopted by more and more countries before we have vaccine. That's very important. And in terms of this lifting, yes, for public health measures, it's not a switch of on and off. It's too dramatic, and sometimes it's not working. So it's better we can tune it along the way, that how strict the restrictions you can impose when the pandemic or epidemics become severe, and when you have already flattened the curve of epidemic, and probably you can loosen a little bit to let the people have more freedom to move around. So that's the way to go. But there's a premise. If you want to do this, that you will need a very sound tracking and tracing mechanism, that you can have a sense of a particular group of people or particular communities that you can monitor their movement, their mobility, that they will not become the source of clusters of infections in the future if you lose it. And so you have to do the digital tracing. That I think a lot of country has a technology, but because of privacy law, they did not use this. And it's sad in the tragedies in this pandemic. And in Taiwan, we implement this digital tracing very successful. Yes, it's infringe a little bit privacy, but it turns out the society accepted because there's a bigger public goods for people to submit this kind of mobility data. Then the society can feel safe, and once there's contact persons identified, and they can be easily and quickly tracked and traced, and if necessary, quarantined. That's how we stop community spreading in Taiwan.
In Victoria, Australia, it's apparent there are a large number of cases where the origins of the infection can't be traced. How concerning would this be to you, and what needs to be done?
Yeah, as I mentioned, that the only things that Australians need to do is to do more testing. But on top of this more testing, you have to have these digital tracking and tracing mechanisms, right? And the third part is you have to build a public health infrastructures, like social workers, public health nurses, physicians, and even pharmacists are working together, as a team to implement the quarantines that people are asked to stay in their apartments and in their houses. I watch from TV. If you are resorting to this military force or policemen, that's very strict, and a lot of time you will get a lot of rebellions from the people. So it's better you put more resource on this soft approach and relies on more persuasions, and probably it will be better and to get people to compliance of quarantine. I think that's needed. But you need to have this digital tracing on hand. that to show people they are a breach from the quarantine areas and persuade them they are posing the dangers to the communities. And most of the time they will follow, because if you have this as an open data, and people will know that at least they should not be so selfish to impose additional risk to the rest of society. So that's the advice I have to Australia.
Will Taiwan open its borders anytime soon? I mean, is a travel bubble approach between safe countries a likely first step, and how successful would that be?
Yeah, apparently Taiwan should be doing this, and I have been advocating this to my government and my society. Said, yeah, because we are doing so well, and during the pandemic, for countries who are doing better, have to step up earlier to bring the whole world to be more open to travels. And apparently this border control measure has to be modified to allow business travel, students returning from their country to these countries, etc. And Taiwan should do this. Unfortunately, because of this so-called second waves coming out from like New Zealand, Australia, Israel, Korea, and Singapore, and even Vietnam, alarm our government to become more conservative right now. So right now, as far as I know, we are not discussing with any country on the so-called travel bubble, or losing some of these border control measures, such as 14 days mandatory quarantines for foreign arrivals. So that's a pity, yeah. But I think we have to base on science and to do more of these discussions, and hopefully that in the near future we can have more free movement among countries.
Often the question is asked, Professor, how long can society keep doing what we're doing? So, I mean, I don't know how long. I would be thinking that it could be 6 months, 12 months before we all start to go, as we would say, nuts. How long do you see a COVID-19 crisis, a coronavirus, coming to an end soon?
Without effective vaccines and therapeutics, the model predict we have to prolong all these non-pharmaceutical intervention, i.e. mask wearing, social distancing, and avoid mass gathering, the so-called new normals, that until 2024. That's the predictions. But right now, we have vaccines coming up, and I'm keeping my finger crossed. The efficacy will dictate how soon we can contain this. So hopefully, by the end of 2022, we can see the light and say that we can transform to a new normal society, that we are still having this virus surrounding us, but we have some weapons that probably we have to be vaccinated every year, just like flu. And we also have to have some kinds of like social distancing policies, and that would be the case. And in terms of international travels, we are never going back to the previous periods. So the travels will take longer and more transit. All these kind of things will last, I think, at least until 2024, when everything has settled down, and we will see whether we can have a new society that factor in this once in a century's pandemic that we have just experienced. So this is my prediction.
It's amazing. Just 6 months ago, we're all planning to do things for the year. The world was sort of humming along, and how it changed so fast. It's very scary. It's probably the perfect weapon, isn't it?
Yeah.
Look,
yeah, this is kind of third world war. We are and very dragon third world wars, and the virus is our enemy, and we all are learning how to deal with this biggest enemy. And countries are aligned together against sometimes, and we are learning. And this is pandemics is changing every one of us and changing the world. And we are unlucky to be in this unfortunate time, but to some extent, this is also a time for us to reflect what humanity should be. Yeah.
I agree, totally agree. It's my trip to Hawaii is off for a long time, I would think, so I'll have to find a local beach around my area and make up a margarita of my own. It's the world has changed. It's been a pleasure talking with you, Professor. Thank you very much.
Yeah, thank you for having me. Yeah, stay safe. Yeah.
And that's it for BNAP Today, August 10, 2020. Be safe and be kind. I'm Mike Ryan.